And
good morning for those of you joining us. It is 10:02. I think we're going to give it another minute or two as folks continue to access the Zoom platform and log in with the password. We want to make sure we give people some extra time to join in. So I think we're going to start at 10:04. All right, and for those of you who are just joining in with us now, we will get started in about a minute. All right, let's go ahead and get started. I know there's probably going to be a few more people still joining in on the Zoom platform and getting logged in, but we have a couple of minutes of some housekeeping to go through anyways before we get into the meat of the presentation. But first, I want to welcome you to our COVID-19 antigen testing information session and learning collaborative discussion. My name is Aaron Shoemaker. I may be familiar to some of you because some of you probably work directly with me. I am on the Homeless and Special Needs Housing Unit with the Virginia Department of Housing and Community Development. And I will be the moderator for today's webinar. First, I would like to thank Dr. Susan Elmore with the Department of Behavioral Health and Developmental Services for hosting us and allowing us to use this Zoom platform to reach as many people as possible. I have nothing but good experiences with Zoom. And yeah, let's get into the housekeeping before we get started. A lot of this is going to be repeat if you've been on some of these sessions, but I'm going to go through it anyway. We're recording today's session and we will share a link at a later date. Most likely it will probably end up on the YouTube channel for D8CD. So when we have that, we will keep you posted and send out that link. And we will also have a PDF of these slides available in the near future as well. I have some information here about real-time transcriptions. Any agency or provider who receives federal funding is under one of the many laws to provide accessible communication, including but not limited to computer-assisted real-time transcriptions, or CART. As an accommodation and to educate you on how to do real-time transcriptions, CART, please copy the link in the chat and paste it in a browser different than the one you are viewing the meeting on. For example, if you're viewing Zoom through Chrome, you can paste it in Internet Explorer or Firefox. And it sounds like this is so that you can easily navigate split screen and have the screens side by side so you can follow the presentation on one and have the captions on the other. And so this enables you or anyone who is hard of hearing, deaf, has a brain injury or other ability challenge to read the words spoken by the speakers and at the same time see the slides. Okay. All right, and I believe I did see the link pasted in the chat. And then just a few more items. Due to the size of the call, we placed everybody on mute. However, this is meant to be a discussion. Part of it will be a presentation, but we will want to hear from you. And so we encourage you First and foremost, you can use the chat at any time for posting in questions, but you can also use it right now if you would like to introduce yourself. You know, the name of your agency, who you are in that agency, and if you feel that it's relevant, the jurisdictions and municipalities and COC that you work with. And yes, we will have a question and answer session later on where we will address those questions. But at any time you can post those questions in the chat box. So yeah, let's go ahead and get started to why we're here today. And so first, I just want to thank you for joining us, and also thank you if you were one of the folks who filled out the survey on COVID-19 testing in your community or your specific agency. Your input is very valuable, and that's one of the reasons that we're doing this today. Today's session is basically three different things. It's an informational presentation, it's an open discussion, and it's also a learning collaborative, a chance for you to learn what other communities in Virginia are doing in relation to COVID-19 testing and homeless services. And so the presentation will focus on the status and the importance of routine COVID-19 testing in Virginia, and specifically in homeless services, even in a world where there is a vaccine. And so our experts today will provide you with an overview of some data. They'll discuss the antigen test, testing in general, Virginia Department of Health resources and how you can access them, as well as the Clia certification process. And they will define what Clia is. So don't worry if that's not a term you're familiar with. Following the presentation, we will have a question and answer session after that. And then we're going to get into the results of the survey that many of you filled out about COVID-19 testing in your agency and your community. And based on the survey results that we reviewed, we pulled out some of the folks who responded and asked them if they would like to chat today informally about what they're doing in their community. And the purpose of this is not meant to be us telling you what best practices are necessarily. It's a chance for you to learn about the successes and challenges that other communities have faced in relation to administering routine COVID-19 testing with the populations being served. And then we'll round out the discussion. We really, nothing would make us happier if you brought questions in and participated. That's one of the main reasons that we're here. And so we brought in some prepared questions, and we're really excited to hear back from you. So with that, I will very briefly introduce the presenters today that are going to be speaking, because again, I'm not I'm in housing, not with the Department of Health. So with us from the Virginia Department of Health, we have Dr. Brooke Rossheim, who is a public health physician specialist on the COVID-19 testing team with VDH. We have Deborah Hopkins, who's an acute care and Clia supervisor with the Virginia Department of Health, and Dr. Armand Devani, who is an antigen testing training coordinator, also with the Virginia Department of Health. And we've been coordinating extensively. I'm going to give credit especially to Sabine Stromsey, who is a senior consultant with VDH's consultant Deloitte and Touche LLC. So with that, Susan, I think we're ready to move the second slide and have you put in that polling question. So you should have a window that popped up where you have the opportunity to fill out a poll. So that I'll read you the question. Please check what type of antigen testing you have done to date, and it's multiple choice, so you can check multiple boxes. And then the second question after that is, did you attend the previous webinar on antigen testing that we did several weeks ago? And just check the boxes and submit when you are done.
Go get yourself something to eat. I'm a little hungry.
Looking good. It looks like we have about half of the participants that are checking in the poll, so we might give it another minute or two, couple seconds. You have to answer both questions before the submit box will come up at the bottom. All right, let's see what we've got, Aaron.
Right. All right, looks like for the first question about which type of antigen testing have you done to date, 26% that said all testing through local physician office, the health department for FQHC. 9% said do not have a Clia certificate. Only 4% said that they have the Binex Now antigen test. And then 65% said have not done any antigen testing, so more than half. And then for attending the previous, looks like about half said no, 48%, 39% yes. And then some folks were either watching the video or not aware that we did that session. All right. Thank you. And with that, I believe I will be passing this over to Dr. Brooke Rothstein with the Virginia Department of Health.
Okay. Can everybody hear me, first of all?
Yes, sir, we've got you.
Okay, great. First of all, good morning to everybody. I want to thank you for joining this webinar. We're going to talk about antigen testing, and also we're very interested in getting your feedback about testing, both testing in general. I always like to talk about antigen testing first by giving an overview of where we stand with COVID-19 in the Commonwealth. So these are data as of yesterday. You can see that in total cases, we are almost approaching 619,000. Total hospitalizations, about 26, almost 26,500 in total. And total deaths, about a little over 10,252. In the map, what you see is the darker blue is the greater number of cases, and you can see the distribution across the state. Not surprisingly, you see that the big population centers of the state, since we're just looking at the raw number of cases, you see that Northern Virginia is in dark blue. You see that Central Virginia, the Richmond metro area, is dark blue, and you see that Hampton Roads is dark blue. But you see that other areas of the state have been affected by COVID as well, which is sort of the next darkest shade of blue. Could I have the next slide, please? So this is a graph that shows the statewide PCR test positivity rate as of yesterday. So as y'all probably know, PCR testing is genetic testing for COVID-19. And so what this looks at is statewide data. And so what that yellow line, that's what I want you to focus on, is the yellow line, which is the 7-day moving average of PCR positivity. And so as of yesterday, 5.8% of all PCR tests that were done, and that's an average of the previous 7 days, 5.8% were positive for COVID. So that is, good in the sense that we have come down from you can see that yellow line goes way up in late December, early January, which is when we had our last surge of cases of COVID. So we've come way down from there. But what you see is that at the tail end of that line, you see that it's kind of curving back up, and that has us concerned. So next slide. So this is antigen, looking at antigen tests. So antigen tests are what we're going to talk about more today. we look at those separately, and we also have combined numbers. The yellow line again represents a 7-day moving average of positive antigen tests. You can see that the scale is different compared to, which is why the yellow line looks different. So right now, as of yesterday, 7-day moving average is 7.1%. And that is, again, you can see that the tail end of that yellow line is kind of climbing back up, which is consistent with the PCR positivity data. Next slide. So that's kind of basic information about where we are with the pandemic. So I wanted to talk about just some overall testing considerations, and this is for any kind of, COVID testing. Routine testing is important in this part of the pandemic because routine testing, that is testing people who aren't sick, which we also refer to as screening testing. It's a way for us to identify people who are ill, who don't have symptoms, because we know with COVID-19, roughly, 40-ish to 50-ish% of people who are infected will not have symptoms. So it allows us to identify infections. It also allows us to do contact tracing of those people who are cases, who are infected. It also allows us to identify SARS-CoV-2, that's the virus that causes COVID-19. It allows us to identify variants. And I'm sure you all have heard about these variant viruses. And that's all of this is in the context that, we have 3 vaccines that are being given aggressively. So the thing is, even though vaccines are available, we still need testing. Testing is obviously important to contain any kind of an outbreak. You need to know who's positive, who's not. Testing is important for staff and residents of congregate care facilities. Congregate care facilities are at a little bit higher risk because people are close together. People may not be able to social distance as much as they can. So again, testing comes into play. And also, we want to consider testing to those people who are coming into a facility, such as contractors, therapists, doctors, people, so people who may bring COVID with them. Next slide. So I want to talk about 3 types of COVID tests that are out there. You have antigen tests, and antigen tests are diagnostic tests, so they're used to make a diagnosis. What they do is they use a nasal swab to detect proteins that are on the surface of the virus, and that's what we refer to as the antigen. These antigen tests are easy to use. Some of them do use some kind of an analyzer device where you basically take the nasal swab, you put it in some kind of a solution, and then you put the solution onto a little cartridge and you put that into a machine. Some of these antigen tests are like, for any of you who are familiar with the Abbott Binax Now card that you're going to hear more about later, these don't require any kind of a machine. These are basically self-contained tests that are basically, similar to a home pregnancy test in that basically you just put the solution right onto some kind of a strip or card, and basically you wait for about 15 minutes, and then you'll have a result. The next test is a PCR test, polymerase chain reaction. This is another diagnostic test used to look for current infection. This is a genetic test. So basically, this is a test where you use a nasal swab or a throat swab that is then put into some sort of viral transport medium, some sort of liquid. And what happens is that a test is done looking for the RNA of the virus. This test is considered the gold standard, and there are point-of-care PCR tests that can be done on site now. These tests are a little bit more involved, tend to be more expensive, and also, whenever people go into a facility and have their nose swabbed or throat swab, and then the test is sent out somewhere to an outside lab, that is almost certainly PCR testing. And then the last kind of testing is antibody testing, which is also referred to as serology testing. This is a test that is done looking for previous exposure or possible previous exposure, excuse me, to COVID-19 using a blood specimen. So basically what you're looking for simply is just, does the person have antibodies to COVID-19? Now I will tell you that the serology, the antibody tests are not perfect because there are other coronaviruses that are common coronaviruses that cause basically the common cold. And so sometimes there is crossover where you will, the test will be positive, the antibody test will be positive, but it's not because somebody had COVID-19 before, it's because they had a previous coronavirus infection, one of the ones that just causes the common cold that we've known about for decades. So those are your three types of tests. The one we're going to talk about today is the antigen diagnostic test. Next slide. So basically, the purpose of this slide is just to give you some of the names. The three tests that tend to be used most in Virginia are in the little box. You've got the Becton-Dickinson or BD Veritor system. That's an antigen test. You've got the Abbott BinaxNOW COVID-19 antigen card. The AG stands for antigen. And then you've got the Quidel Sofia 2, and these are just the manufacturers and their brand names of tests. The one thing I will note is that all of these are fast results, 15 minutes, which is great, and that is a huge help from both a patient standpoint and a public health standpoint, because it allows decisions to be made very quickly, which is, on an individual level and on a public health level, which is what we want. One thing I will note is that antigen tests in general are less sensitive compared to PCR tests. Now, what does that mean? What it means is that the antigen test is not quite as good at picking up people who are infected as PCR testing is. So what happens is sometimes with antigen tests, you can get false negative tests. So that is that the antigen test is negative, but it's what we call a false negative because the person is actually infected. And in these cases, if we are concerned about a false negative test, then we sometimes will recommend to have a PCR test done to confirm the result of the antigen test. Next slide. So, who do we, in terms of testing overall, who do we like to really focus on? So one area that we try to focus our testing overall is areas, people in areas where there's a lot of community spread of COVID going on. That just makes sense. We try to focus on people in areas that have high numbers of vulnerable populations, because these are people who might not otherwise be able to get a COVID test. And our goal is really to test in a widespread way. Obviously, people who have difficulty accessing testing, we would like to get to them. Historically, Black colleges and universities are also a focus area that we would like to test. And people with medical comorbidities, so people with other medical problems. These are people, if they get COVID-19, they are at higher risk of having a more severe case of illness. So we like to test these people. Next slide. So where is antigen testing useful? So antigen testing, the main use of antigen testing is really in these top two bullets. People who have symptoms that are consistent with COVID-19 and people who are asymptomatic, have no symptoms, but who are a close contact to people with known or suspected COVID-19. Now, having said that, you can use antigen testing in other areas. You can use it in asymptomatic people who are working in a high-risk setting. So what's an example of that? So what about if you are a nurse working in a nursing home? You know, you're asymptomatic, but you are working in a high-risk setting, a nursing home. So those people can be antigen tested. The other thing is, like we talked about in a previous slide, you can use antigen testing on asymptomatic people who have no known contact with a COVID-19 positive person, and that's what we refer to as screening. An antigen test can be used for that purpose also. Next slide. So requirements to conduct antigen testing, you need to obtain a Clia certificate of waiver, and you're going to hear more about that. You need to have training, and both Abbott and Becton Dickinson, which are the tests that we offer online training, and Abbott also offers an in-person, virtual webinar. You need to have a prescriber. So these are, by and large, these are prescription tests. So you need to have someone with prescriptive authority. And I'm going to tell you at the end, I'm going to tell you something that's going to be a little bit interesting regarding that. So you got to have someone with prescriptive authority who writes for the test and reviews the result. And then the last thing is you need to report the result to VDH via our secure reporting portal. I know it looks like a lot. These requirements are actually not too difficult to fulfill, and we can help you. So we're here to help you, and that we can provide that. And then I just want to give you my contact information. So if you are interested in ordering Abbott Binax Now antigen cards or BD Veritor Becton Dickinson test, please contact me. And my email is there. You can also reach out to antigeninfo at vdh.virginia.gov, which is another, you can contact all additional questions about antigen test distribution. I'm going to turn it over now to Deborah, and I'm happy to take your questions in the chat. Thank you.
Thank you. I had to unmute myself. I'm here to talk to you about Clia. You heard that phrase. What does that mean? Clia stands for the Clinical Laboratory Improvement Amendment, and that's a federal program that ensures quality lab testing, and it's administered by the state agency here at the Virginia Department of Health's Office of Licensure and Certification. So any entity that does human testing for diagnosis and treatment needs a Clia certificate. A Clia certificate of waiver is a type of certificate that we issue. Facilities that have this certificate of waiver can perform tests that are classified as Clia waived by the FDA, or have an FDA emergency use authorization for testing in the waived environment. Sometimes folks are not sure if they actually already have a Clia certificate. So here I've listed 2 links where you can go and look to see. One's a CDC link and the other one is a CMS link. If you don't have a Clia certificate and you want to do COVID antigen testing, you would need a Clia certificate of waiver, and you would apply using what's called a CMS 116, the Clia application for certification. The simple way to get this form is just to go to your search engine and type in CMS 116, and you'll get a list of links coming up, and select the cms.gov one. It'll have a downloadable form. It also has a quick guide on how to fill the form out. Next slide, please. So here is just a couple pictures of the form. It is 5 pages long. You need to complete pages 1, 2, 3, and 5 for a certificate of waiver. Highlighted are the fields that are required. Next slide. Important, one of the things that folks forget often is the estimated annual test volume. How many tests do you guess you're going to do? That's in the middle of page 3. Tax ID, people seem to forget. And then page 4, you just leave blank. And page 5, you need a signature. Next slide. So after you complete this form, you're going to want to send it to our office via snail mail. Here's our office address on Mayland Drive. We can only accept an email application if it's password protected for the signature line. We do recommend overnight delivery. If you're time sensitive, you want to start really quick, get it to us overnight, and then we can go ahead and process it. We are processing within a couple days of receipt. If you include an email address, we'll email you the Clia number after we've processed it. Do not send any money with the application. The fee is $180 for a 2-year certificate, but you'll get a bill for that, or you can pay that online at pay.gov. So here in the middle of this slide, we have our email address, clialab@vdh.virginia.gov. We'll be happy to answer any questions. Review your application prior to you sending it to us for completeness, and generally be a resource whatever you need, Clia related and laboratory testing related. Thank you.
Good morning, everyone. I'm Dr. Armand Devani, and I'm just going to give a quick overview of the Binax Now test and follow that with some training resources and the reporting requirements. Next slide. So a nice thing about these tests is that they're minimally invasive, as shown in this illustration. And to collect the sample, you take one of the provided swabs and insert it no more than 0.5 to 0.75 inches into the nostril, and you rotate the swab around the nostril wall 5 or more times for about 15 seconds. And then using that same swab, you repeat the process in the other nostril for another 15 seconds, and that's it. You have your sample. Next slide. And so here we see pictures of the Binax Now test card closed on the left and opened up on the right. And every box of Binax Now contains 40 of these tests that are about the size of a credit card. And you also get a bottle of reagent, the nasal swabs for the sample collection, and some information documents. And the most important tool not included in the box, but is easy to get, is any kind of timing device. And it could be a dedicated stopwatch or even the app on your smartphone, but every test operator needs some kind of timing device so they can read the result after 15 minutes. And storage isn't an issue because it can be stored anywhere from 2 to 30 degrees Celsius. And it's actually easier just to keep it at room temperature because that's the temperature needed to perform the test. Next slide. So now here are the steps to run the test. You'll start with the open test card laying flat with the reagent bottle nearby. And you add 6 drops of that reagent to the top hole in the card. And then you insert that specimen swab with the collection. and you insert it from the bottom of the card until you see the swab tip in the top hole, and you'll rotate that swab 3 times clockwise, and then peel off an adhesive tape and seal the card closed with the swab still inside, and then start your timer. And after 15 minutes, you can read the result. It's as simple as that. And so if you see after 15 minutes, you look at step 5, and you'd want to see one of these 2 pictures for your result. If it's like one pink line at the top, it's a negative result. And if there are 2 pink lines, it's a positive result. Next slide. And so that was the brief overview. And hopefully I was able to show how straightforward the test really is. And of course, all the test operators need to be trained before they start testing patients. And this can be done by going to Abbott's training webpage. And that link is shown at the top of this slide. And that page includes training videos, PowerPoint presentations, other helpful documents. And so going over all of that information is one way to be trained. And the other way that Dr. Rossheim mentioned is that VDH works with Abbott to provide train the trainer webinars. And so that way, because it's with a live representative, you could ask questions in real time. And people who attend that can then train other staff members on how to do the test. And if that's something you'd like to schedule, you can email antigeninfo at vdh.virginia.gov, and I can get you in touch with Abbott to schedule a session. And then also here we have Abbott's phone number and email address if you have any technical questions to get in contact with them. Next slide, please. And the other point of care test mention that we provide is the BD Veritor. And to be trained on how to use this test, you can go to bdveritor.com/training. And on their page, they also have training videos as well as an e-learning platform that you can sign up for. And that contains various modules going over all aspects of the test. And within those modules, they have little assessments to make sure you understand each topic. And then at the very end, they have a final assessment that needs to be passed in order to receive a certificate of completion that can be printed out. Next slide. And so while training is a requirement to use these tests that we provide, no completion of training needs to be submitted to VDH. We just ask that every facility who's completed, document who's completed training and is proficient in operating the test for their own records. And this document could be something that's done by a supervisor or a trainer. And VDH also provides training resources on their emergency preparedness webpage that the link is provided here. And on that, you can find information on how to properly collect specimens, find an example of a checklist to assess proficiency and other information. Next slide. And so the other main requirement to use these tests is reporting test results. And all results, positive and negative, must be reported within 24 hours of receiving the results. And this can be done by using the VDH reporting portal, which I've included a link to here. And patient level reporting is required for all positives, and it's desired for negative test results as well. But But the nice thing is that you can submit aggregate negative test result counts, which makes reporting a little easier. And what this means is that for the positive results, patient information such as name, address, gender, and phone number need to be reported. But for the negative results, you could just provide the daily negative results without having to include all the other information. And next slide, please. In order to use this portal, an account must be made. And when you go to the main page, there is a login section that looks like this picture here. And below the login, there's a link for new users to sign up. And we strongly advise facilities to make sure that they're signed up well before they begin testing, because it can sometimes take 2 to 3 days for your account to be approved and gain access to the portal. And if you have any technical questions, you can contact the reporting team directly at pocreporting@vdh.virginia.gov, and they can help you. Next slide. And so that's all I have to share. And before we start doing questions, I'd just like to remind everyone that requests for Binax Now and BD Veritor can be sent to Dr. Brooke Rossheim, and any additional questions can be sent to Antigen Info, and we'll have all that contact info listed at the end of the presentation. Thank you.
So this is Brooke Rossheim. So I figured now would be a good point to tell you some breaking news. This is information that just came out from FDA yesterday, and I got an email from FDA about this today. So FDA has taken some of these, in its normal state, like I said in the presentation, the Abbott Binax Now test is a prescription-only item. What FDA has done as of yesterday is they have made a number of these prescription antigen tests over the counter. And so now, basically, you would not need a prescription for the test. So you would not need that prescriber. Now, that's a big deal, because that really opens up the ability of places to get tests, on their own without having a medical provider present. So that is a very welcome development. So I wanted to let everybody know that. Now, this is new information, and I need to myself go back to the FDA website, because it is so new, and see what the details of this are. But I did want to let people know that. So this is, hot off the press, and this is definitely going to make antigen testing easier. So I wanted to let y'all know that.
All right. Thank you, Brooke and Armand and Deborah, for sharing what you did and lending your expertise on the information provided. And I hope that was informative and helpful for everybody who is in the audience. Before we move on to the survey results and then the larger discussion, Learning Collaborative, we wanted to open up for questions. If you have any questions about the content up until this point, or just any questions in general about testing. And I do see that we have gotten one for Dr. Rossheim in the chat at this point, and that is, do you recommend routine testing in a congregate setting where most people have been fully vaccinated? And so a congregate setting, just for clarification, is a shelter where there's either multiple units in the same building, or in some instances, it's where the population being served may even just all be in one room.
That's a very good question, and the answer is that it is there is not a formal recommendation on the table per se. The way that we have phrased that is that is something that can be considered. Me personally, I think it's a great idea, because a congregate setting is a higher risk environment. And so, on CDC's, in CDC's documents, they identify it as a higher risk environment of getting COVID-19 as well. So the answer to the question is essentially a yes, but CDC has not gone as far to say, yes, we recommend that you routinely do testing on these people. What they have said is that we consider that you routinely test these people.
All right, thank you, Dr. Rossheim. And looks like we don't have any additional questions at this point. I'm looking at the chat here.
Aaron, I'm gonna sort of put out something. One of the things that people may be wondering is, do you need to be a medical person, a nurse, a nursing assistant? Do you need to be, some kind of a medical person to do these tests? And the answer is no, you do not. And that's part of the reason why you see FDA putting these tests over the counter, because these tests are easy to do. They all come with instructions and training. And what you're going to find is, even though we've covered a lot of ground regarding, Clia certificates and training and things like that, is that in reality, these tests are meant for everybody. And the other thing is, if you're buying a test, over the counter, then Clia does not apply. And so, if you are just using it for personal use, then obviously you're not a testing center. If you're just doing it for yourself, that's Clia is not applicable. So these tests can be used and really are heading to the over-the-counter market, so basically that anyone can use them. I mean, it's similar basically to what has happened with pregnancy tests. Those are readily available over the counter.
All right, thank you for that explanation. And I think it looks like, unless there's any additional comments that the panel wants to make, it looks like we can probably go ahead and move on to the survey.
Aaron, can I mention one other thing?
Absolutely.
Thanks. Another reason why we encourage testing of those particular groups that we talked about, those groups that are at somewhat higher risk of getting COVID-19, is because of the issue of variant viruses. What variant viruses are is these are viruses that are when the COVID-19, when the original SARS-CoV-2 virus replicates, when it reproduces, there are mistakes that happen in virus replication, and that's normal for any virus. That's typical. And what happens is that produces a new virus that is basically a cousin of the original. And sometimes that cousin of the original turns out to be have some properties that are more concerning than the original virus. So, for example, we find out that the cousin of the original may be easier to spread. We find out that the cousin of the original may be more virulent in that it makes people sicker than the original. So one of the reasons that we do encourage testing of these higher risk groups, and one of the higher risk groups would be people who are living in a homeless shelter and people who work there. One of the reasons we encourage testing is because that's a way to find these variants. Right now, people don't come in. Right now, when people come in with a variant illness, they don't look any different than people that have, regular COVID-19. So there are no features that would suggest that, okay, well, this person has a variant. And so what we have to do is we have to rely on testing. Variant viruses are a hot topic right now because we're seeing more of them. And some of these variants look like, at least one of these variants looks like it has some properties that it may be a little bit more transmissible from person to person. And also the other thing is that, when you start talking about vaccines, the vaccines that we have were developed against the original COVID-19 virus, the original SARS-CoV-2. One open question right now that people are really trying hard to find the answer to is, how well do these vaccines that we have right now work against variant viruses? So again, it's one more reason to promote testing, because testing allows us to know how are we doing with these variant viruses. You know, how widespread are they? And without testing, we don't really have a good answer to that question.
Yeah, thank you for that. And that's one of the reasons I was excited that we were doing this session today, is to ensure that we're continuing to emphasize the importance of routine testing. All right, well, are we ready to move on to the survey results?
Yeah, so I'm gonna talk about the survey results, and Sabine, who is our consultant from Deloitte, may want to chime in here as well. So if we could go to, so we, as all of you know, we sent out a short survey, and we appreciate everyone taking their time to complete the survey. So we wanted to share the results with you. So the first question was, and by the way, if you have questions, comments, anything, please feel free to put them in the chat. So what is your strategy? So what is your strategy? These are questions that we asked the homeless service providers and the continuum of care providers. What is your strategy to conduct COVID-19 testing among households experiencing homelessness? And you can see that the largest answer was partnerships with other agencies at 38%. So 23% said that they had no formal program. 11% talked about doing outreach and point of care testing. So point of care testing would be like the Abbott Binax Now card or the BD Veritor test. 10% had talked about transportation and using mobile units. 14% talked about advertising and word of mouth. And you can see, I'm not going to read the and then you've got an other category. And I'm not going to read the comments, but you can see that you know, that the biggest category is you know, partnering with another agency. So that might be the health department. That might be others. So if we could go to the next slide. And this is a similar question. So to what extent does your organization facilitate or provide testing for people entering shelters? The largest answer, 51%, was that our organization refers people to another agency that provides testing. The second most common answer, 24%, was that our organization does not provide or facilitate testing. And then you saw that 9% of, you know, smaller percentages talked about that they did have some sort of mechanism to test people who were entering congregate shelters and non-congregate shelters, or people that only entered congregate shelters got testing, or there was also an other category, or that people who met certain criteria. So for instance, they had an exposure to somebody with COVID-19 got testing. So basically, you know, it's really good that there are these partnerships, you know, in terms of, you know, referring to other agencies which provide testing. And I think part of what we want to, you know, throw out there is that, you know, maybe your organization wants to consider testing on its own. So that's one of the thoughts. Next slide. So this question 3 asks, how is COVID-19 testing accessed by people experiencing homelessness in your community? The number one answer was health department doing testing. Second answer was an urgent care center doing testing. The third most common answer was a private testing center. So for example, that might be a nonprofit in the area. that has got point of care testing, like Binax Now cards, that is doing testing on its own, or a private testing center could be a free clinic that is doing testing for COVID-19. The fourth most common answer was a pharmacy, and I want to take this opportunity to let everybody know that VDH has a partnership with Walgreens, and so we have an agreement with Walgreens in about, I would say right now it's roughly about 50 stores in the state where people can get tested for COVID-19 for free. So basically they would need to go to the Walgreens website. They would fill out some information to set up a time for testing. And then they would go to the Walgreens and get tested. This testing is at no cost to the patient, and everyone can get tested. No one's going to be turned away. So it's not only for people who have symptoms of illness. So if somebody is asymptomatic and just wants to get a test because they're curious about COVID, whether they have COVID-19, if somebody thinks they had an exposure to someone with COVID-19 and they want to get a test. So I want to make sure that people know about this Walgreens partnership. Right now, about 50 stores. Another thing that I want to let people know about is the VDH testing sites webpage. So if you go to, one way to find it is just to Google VDH testing sites. So what VDH has created is a web page that shows where you put in your address, and it will find the nearest testing sites for where you are. And you can further refine that search by clicking on some additional boxes on the page. So for instance, if you want to find only providers who offer free testing, that's one of the filters that you can apply. So the VDH testing sites, it is on the VDH external website. I can't emphasize that enough. We highly encourage everybody to use it. And it's constantly being updated as new testing sites are brought on board. There are some testing sites, and thank you, I see somebody's put the link in the chat. There are some sites where testing is, is at a cost. And so, we've included, we want to make sure that we get all this information out about where people can be tested. And literally there are hundreds of testing sites across the state. And then number 5 was people doing point of care or on-site testing. Can we go to the next slide? So question 4, does your community have a specific formal or informal testing partnership designating testing for people experiencing homelessness? So 42% of respondents said yes, that they did have a formal or informal partnership regarding testing for people experiencing homelessness. 56% said no. And we did put some of the highlighted partnerships on the right-hand part of the slide. Next slide. So does your organization use point-of-care antigen tests such as Abbott Binax Now and or BD Veritor? 37 people said no, 8 people said yes. That's certainly one of the reasons for this webinar is we want to introduce these, these antigen tests, which are, point of care that can be done right where the patient is or the person is. Next slide. So question 6, are there transportation barriers to effective COVID-19 testing in your community? This 66% said yes. 30% said no, 4% not applicable. One thing that came through loud and clear is that rural areas, it is more difficult to get testing because there's lack of a good transportation system, and that is something that we recognize, and that is something where at-home testing may come into play. So that is something that on the testing team we are actively looking into. But we'd also like to get your input about ways that you think that that could be addressed. Next slide. So the next slide was, how confident are you that the people experiencing homelessness in your community have adequate COVID-19 testing? So 13% responded they were very confident, 22% confident, 29% somewhat confident, and 34% not confident. So basically we've got, sort of a, kind of a mixture. We've got some places that feel that they've got good coverage in terms of testing for people experiencing homelessness, and some that don't. Next slide. And what resources and/or services would help improve access and/or administration of testing in your community? This is an open-ended question, so the responses we got: partnering with the health department, assisting with transportation, mobile testing, privacy protection, that's something that we've heard about on a number of calls, education, and additional staffing. And all those responses make very good sense. And those are things that, again, on the testing team, we are looking into also. Next slide. And that's all. So I wanted to give you the survey results, and I'm going to turn it back over to Aaron.
Okay, thank you, Dr. Rossheim. It's good to see those survey results, and once again, thank you all for responding to that survey and providing us with some good data. And so one idea we had for getting this discussion started is when we were looking through the results, we looked at some of the communities that had more confidence, perhaps with their COVID-19 testing. And I asked a few if they'd be willing to share their success stories and also any challenges they faced and lessons. And so I'm going to be calling on a few of them to unmute their mics and spend a couple of minutes sharing their stories. And our purpose here is not to provide you with instruction of exactly what a best practice model is for COVID-19 testing and homeless services. It's not to dictate to you exactly how to do it. We want to have a learning collaborative where you can hear from other communities and perhaps hear some of the unique ways that communities have addressed COVID-19 and been able to actually administer it in their community. Because based on the survey, as you just saw, not every community has COVID-19 testing in their services, and even those that do, many are not necessarily confident in it. So with that, I will ask our first volunteer to unmute and share. And so this is Laura Beth Weaver. Laura Beth Weaver is the executive director of the Women's Resource Center of the New River Valley, and that is a domestic violence provider who provides emergency shelter and rapid rehousing in the New River Valley Housing Partnership. And so as you unmute yourself, I want to remind everybody to drop some questions into the chat because we are here in this session to hear from you. And if we can, even do some live problem solving, if you're having any issues in your community or challenges, we would love to take this time to do that. So with that, Laura Beth, I'd like to hand it over to you.
Sure. Thank you, Aaron. So Aaron asked me to spend just a couple minutes talking a little bit about our community's response to COVID and how that has kind of dovetailed with testing and the things we've been talking about this morning. And so for us, we're in the New River Valley here in Southwest Virginia. We're a very large geographic region. We serve 5 jurisdictions, so 4 counties and the city of Radford. And so early in the pandemic, our folks, I can't take any credit for this, our health department and our local law enforcement and our local community services board, a whole bunch of folks got together and formed a task force so that we could address COVID as a region instead of each locality trying to coordinate with the health department individually. We kind of took it all as a group and problem solved as a group. And early on, they recognized the struggle, I guess, especially for a domestic violence shelter. We never wanted as a community for people to have to choose between staying in an unsafe home or coming into shelter. And the task force recognized that early. And so early on, our health department started coming to do on-site testing for our staff and any residents who were interested or having symptoms or anything like that. And so I don't remember when it started because it feels like it's been going on for 10 years. But early on, we started doing weekly testing on site. And that was supported by the task force. And so they do the PCR testing that goes to a lab right here in the New River Valley several times a week. And so we've had access to that system of testing through the health department throughout. So if we've had someone who's come into shelter with symptoms, or if we've had staff with symptoms, in addition to that on-site once a week testing, we've been able to coordinate with the health department to get tests done whenever we needed them. At one point, we had some folks over the weekend who were showing symptoms, and we coordinated some testing on a Saturday evening and Sunday morning in order to address those needs. And so because of the support of DHCD, we're able to, while most of our folks are in congregate setting, DHCD and our local governments and the task force have allowed us to also use some scatter site shelter so that if folks are experiencing symptoms, we can get them out of congregate setting, do some isolating and testing and keep things under control. Our biggest positive out of all of this has been the ongoing relationship with our local health department. I have the director's phone number and the epidemiologist's phone number on a sticky note here in my office, just right above my computer. And we've been in constant conversation with our local health department staffing cases and getting testing on site and all of that sort of thing. So I really can't take credit for any of it. I just kind of facilitate the moving parts. But those relationships that we formed over decades with our health department and our law enforcement allowed us to tackle this as a community.
All right, thank you for sharing. I do have a question for you about that task force. Has that task force, when it was formed and kind of how it functions, does it coordinate more closely with individual service providers or particular service providers, or does it have more of a linkage to the housing partnership, to your local planning group body?
They really are individual. They seem to find where there's an issue and kind of zero in on that. Because we got in pretty early on it, we've been sending updates and things and getting the rest of our housing partnership connected to the testing and things like that. But what's been really beneficial is the health department, aside from the task force, the health department also has been offering testing in various areas of the communities. Like there's Giles testing days and Montgomery County testing days. And they've had testing available specific days throughout for a long time. I don't know when that started, but I don't know if I really answered your question, Aaron. They don't come to the meeting. They don't come to like our housing partnership meetings, but we were able to make some connections with Carol. I think Carol's on the call today with To Our House, the other homeless shelter here. One of the other differences is that we don't have large standalone homeless shelters. I know early when we were talking about these tests that needed these specific tests that we're talking about today, it sounded a lot like larger homeless shelters in larger kind of urban settings have more people at them, right? But our shelter is capped at 4 families because of COVID. And so even in a congregate setting in the New River Valley, it's going to look very different than a congregate setting in some of our larger populations.
Okay, thank you for sharing that. And unless we have any additional questions, it's like chat is quiet right now. Thank you for sharing, and we may be coming back to you in a second, but we're gonna go ahead and ask one of the other folks who responded to the survey that I reached out to, and that is Blair Copeland. Blair is the Director of Programs at Carpenter's Shelter, which is a DHCD partner and the Alexandria COC. So Blair, whenever you're able to, please unmute yourself and share. And thank you for sharing.
Good afternoon. So it's hard to follow her because we've had much less success here. Our testing facility is in walking distance of the shelter. It is a pop-up site connected to a rec center that the local health department has put up. And we, of course, are encouraging all of our residents to test. And we've gotten a lot of pushback. Residents are not interested. We have a 60-bed facility housing about 45 people because of COVID. So we did what we do a lot of times, which is add money and mix. So we have incentivized testing and COVID vaccination. So once clients enter shelter, if they test within the first 5 days and give us their results, we will provide them $5 as a thank you. And then if they get vaccinated, we will follow that up with a $20 bill. We've had about 2 people start that process. And so we're hopeful that we will continue to see some momentum and have people test as soon as they enter shelter and then also get vaccinated. We're working on our clinic using the antigen testing that was mentioned earlier in this call. And I'm hoping that that will also speed the results that we can get from people entering shelter.
All right, thank you for sharing. And so that incentive approach was something that I saw that was unique and really something that I wanted to discuss with you on this. So obviously you're not using your VHSP funding to provide those incentives. You're having to use like a more flexible funding source. Has it been a challenge to get funds for that? I mean, have you had to, for example, lean on donations from maybe even faith-based organizations or anything like that in order to secure those funds?
So I think we've drawn this from general operations, which obviously we fundraise for. So we haven't specifically asked for assistance with those funds. I imagine if we can get some traction, we might have to. But there's just been a lot of trepidation from residents about testing, no matter how much we try to incentivize and encourage. Again, if we are able to get more people tested, I think we will have to ask for some support around funding that.
Ms. Copeland,
Go ahead.
this is for time. Can you hear me?
Yes, barely, but yes.
Okay. Any better?
No, but I can hear you.
Okay. What has been the concern among residents at the shelter in terms of being tested?
Yeah, I really think it is an emotional response. We have heard just distrust around testing and vaccination and discomfort around testing and vaccination. And we've tried to obviously provide a lot of education and support from staff, from peers. We tried a couple different approaches and haven't gotten much movement in that because I think it really is tied into people's emotional and fear-based response to something unknown.
Okay. Have you found that there is an approach? Well, I guess two questions. Have you found that there's an approach that seems to work regarding, getting people to agree to be tested? And how has, well, I'll let you go ahead and answer that one first.
No, we have not found an approach that seems to work for residents. We have agreed, because there's a question in the chat box, we have said outright that we will continue to serve anybody who's positive. And we've had people who have come in and tested because they've been to the hospital, et cetera, and we're waiting on responses, and we were able to do some separation of guests so that, we could, quarantine people. So we will absolutely serve people, even if they were positive, and we, have relationships with Fairfax County to use hotels to have people isolate or quarantine. So I think the fear is just around COVID in general.
Okay. And how is the how has the $5 incentive worked? Has that been useful?
So again, that's the beginning. So if someone comes in and will test within the first 5 days, they're in shelter and provide the results, we'll give them the $5.
Has that encouraged more people to test?
No.
Okay. All right.
It is a
Thank
struggle. I mean, as I mentioned, it is walking distance to get to the testing site. We're just continuing to beat this drum and hope that people understand that it's really important for them in congregate settings, important for all of us. We did something very similar for staff. If you got fully vaccinated, you were given $50. And that moved the needle a tiny bit for staff.
Well, thank you. I want to thank you for your continued efforts because, sometimes you just have to keep promoting, messages and sort of eventually it kind of sinks in as people feel more comfortable. And thank you for the information too.
Absolutely.
Yeah, I think I just have one more question about the incentive. Is it done on cash or is it a gift card?
Cash.
Yeah, and my thought is, wondering if maybe gift card is something that triggers more of a response incentive-wise that people hear maybe the word gift, but maybe that's just how my brain works.
I think cash is a great gift, and we will provide it immediately, as opposed to you have to go to the store and get whatever you want. I will give you cold hard cash if you can provide me proof of your testing and or vaccination.
Well, thank you for sharing. And actually,
Sure.
more, about this, what was the thinking in starting the incentive program? And since it's not, it sounds like maybe it hasn't had the success that was expected from it. I mean, have there been thoughts of evaluating it and maybe finding a different strategy?
Yeah, it's fairly new. So about a month or so, we started to talk about this because we were really sure that we could get the vaccination part of it. The testing was always available, and we didn't have very much response unless there was sort of a negative connotation, i.e., there was someone who thought that they were going to be exposed or they went to the hospital, as I mentioned before. So we thought, what is a good motivator, and landed on money. But I think you raised a good point. What else would motivate someone to do that if they're not self-motivated? And I don't know, and maybe time to go back to the drawing board and think about what other things we can use as carrots.
Yeah, and it makes me think maybe there's some resources that when we send out the slides for this, because I have been on webinars where this has been a main topic, is how to overcome the fear of testing as well as vaccine, just being involved in that process at all. So maybe we're going to be able to get some information on that. We actually do have a question in the chat. Can you provide additional funds for clients who make referrals to other clients?
Sure, I think that's one way to manage that. I don't know who's going to sort of follow that chain, but it's an interesting thought. I mean, I think I would be willing to do that if we got momentum around people just testing and being vaccinated. But perhaps that would start a chain reaction if someone goes and gets tested and then says, I've encouraged other people because their peers are more involved. So thank you for that.
Well, thank you so much, Blair, for sharing your story with your community. Now you've been doing testing. It's been very helpful. And with that, I will call on our the last person who has agreed to discuss, based on the survey results, what is going on in their community, and that is Sarah Quarantoto, who is the executive director of Miriam's House, which is a DHCD partner in the Lynchburg area and the Central Virginia Continuum of Care. So, Sarah, whenever you get a chance to unmute yourself, feel free to hop in, and we're looking forward to hearing from you.
Hi, yeah, thanks for having me. So similar to Laura, early on in the spring of last year, our COC, Central Virginia, which covers the city of Lynchburg and the 4 surrounding more rural counties, we gathered together all of our shelter providers, our local health department, our hospital system, our city's emergency services, really everyone at the sort of virtual table to talk about a plan for how to address homelessness and sort of in a COVID world, and how we can really be sure to serve our neighbors well, stop the spread, all the things that everyone else talked about. So we came up with a really collaborative operating procedure that had lots of buy-in from all the partners. And then obviously, as things continued, as we learned more, as testing became more available, as we knew more about screening and what questions to ask, we revised that standard operating procedure as we went. And so I think that collaboration was really incredibly helpful. One thing that has been really successful for us is that the COC has always had a really strong relationship with our FQHC. And so one of their leaders sits on the COC board. And so we've had lots of collaboration over the years, back when there was gap insurance enrollment, and just kind of, carries on to this day. And so so that relationship has been really helpful in that we have 2 large-ish congregate shelters that are in the city of Lynchburg that serve the counties. And both of those are in pretty close proximity to our FQHC Johnson Health Center. And so we were able to set up a streamlined process with them, whereas individuals experiencing homelessness who either had an exposure or who had some sort of symptom associated with COVID was able to get a rapid test, which obviously was super helpful to have that access so that we could really quickly identify which person's experiencing homelessness had COVID. We could isolate them. We could quickly identify who else they had been in contact with to alert them. So I think that relationship was really vital. We, to make sure that we are properly testing, we don't unfortunately have access to test everyone experiencing homelessness, but each day our congregate shelters do a screening with all the persons that they're serving that ask questions, takes temperatures, ask questions regarding COVID and exposure. And then those who sort of go through the screening and at the end it identifies whether or not that person should be referred to the FQHC for a rapid test. So I think that kind of streamlined process has been really helpful. It's also given the shelters a lot of assurances that, that they have access to testing, that they have access to isolation for individuals that they're serving. The other really successful thing has been that partnership, having everyone sort of at the table, allowed for all of our homeless providers to have really early access to the COVID vaccine, because our city leaders were, and our health department was so aware of the work that our street outreach team, our shelters, our rapid rehousing providers, all of our homeless providers were doing. And so really early on, we also were able to get all of our shelter workers, all of our homeless providers vaccinated, which I think also has given a lot of assurance as they continue to work with, you know, a really high risk population. So that's kind of what we're doing. I think I'm really inspired by the recommendations to have more testing available to identify asymptomatic individuals. I think that would be, you know, really ideal and sort of what we can sort of start to work towards. So that's essentially what Central Virginia is doing.
All right, thank you for sharing, Sarah. And it sounds like there has been a lot of strong oversight in this process in your community. And my question is kind of a running theme with this presentation, and that is, or just the discussions we've had with communities that led to us having this webinar, and that is with the vaccine and success with vaccine rollout. Has it been a challenge to keep interest and doing routine testing?
Yeah, so unlike some of the other communities, we haven't had testing of people experiencing homelessness that were asymptomatic, or so that hasn't shifted because we've never had sort of just routine general testing that happens weekly. I think that's amazing. We've only ever had access to testing for homeless persons who either had a symptom or had an exposure or had some reason to believe that maybe they had COVID. And so it's a little bit, so no, I think, unfortunately, because we didn't have that, we now don't have a problem continuing that same access.
All right, well, thanks, Sarah. And I'm not seeing any questions in the chat. But yeah, thank you for, thank you all for you for sharing the successes and challenges that you faced in your community. And we did schedule this for noon. So, and thank you for sticking around, everybody, for as long as you have. We have remaining in this session, we're going to close out with some discussion questions. And this is where we especially like to hear from anybody out there, just questions that, any questions you have in general up to this point, but we want to pose these questions to you, and feel free to use the chat. And also if you are one of the three who just spoke, also feel free to unmute yourself as well. So at this point, what we have an idea from the survey, but what is limiting individuals from accessing testing in your community? And actually, I have, well, never mind, I'll save it for later.
I will just say briefly that in Northern Virginia, transportation is not the easiest. So getting around to a couple different locales can definitely be a hindrance to it. We don't do testing at our shelter right now. There's been 2 COVID cases, which has been pretty fantastic over the past year, all things considered. But it is a little difficult for our clients to get around if they don't have a car.
Yeah, transportation, I think that might be number one in the barriers that we've seen, which is why we actually pulled that out in the discussion. And this is kind of a question we were talking amongst ourselves during the presentation. Is Medicaid an option for paying for transportation to COVID testing? Is that something that is a possibility?
Aaron, this is Susan Elmore. If people have Medicaid, then yes, we can use it for testing and we can get that information to your communities. My question was, how many of the individuals who come to a homeless shelter would have Medicaid? So if your providers could kind of give us an idea of, is it 5%, 10%, 25% that come in that already have Medicaid, then that would be an avenue that we can get some additional information, because there are provisions in place for Medicaid for anyone who thinks they are COVID positive or anyone who just wants to go to testing. And to the gentleman who just spoke from Northern Virginia, what areas in Northern Virginia are you in? So that I can get an idea of the transportation. Are you in Loudoun County, or are you down in one of the urban areas?
We're in Prince William County, and that covers Manassas and Manassas
Okay.
Park. I'm Michael Tamala, by the way. Sorry, I didn't say that before. And for your question about Medicaid, I would say it's actually a much higher percentage from that in my experience. I haven't been at this shelter for a while, but I've worked in shelters for the past 3 or 4 years. And I would say in my experience, it's probably closer to about 50% of people that have Medicaid. It's usually something that is recommended for people with low income, and with the coverva.org website and going through Department of Social Services, it's not that difficult to get signed up for. Other people, I'm sure, have different experiences with it, and maybe mine's a little higher. But I will say that I do run into a good majority of people that have, or a good chunk of people that have Medicaid.
Okay, because if they have Medicaid, then we can hook you up with how to do the MOVA care and get through that. So that might be another presentation we can do, Aaron, to help the group out there, as to how to access Medicaid for testing, for vaccinations, for the appropriate way to get through in a timely manner, shall we say.
Absolutely. And Prince William County, DSS, they partner with George Mason, is my understanding, to do testing. The MAP clinic, I think it's called.
Yeah, that's the case. And they actually came in to give a round of COVID vaccines at our SERV shelter as well. We get our second round of the night.
Well, so that's a unique partnership, I would think, but it might be helpful for the group to hear what were the steps for initiating and maintaining that partnership.
I do apologize. That's going to be something that I'm not too sure about. I started this job a little less than 2 months ago, so this partnership has been going on for quite some time, and I'm new to this COC, so it's going to be hard for me to speak about that, but it's something that I can find out if you'd like more information in the future.
Sure. Yeah. I just imagine that there's quite a few communities who have universities in them, and I imagine that there's probably partnership opportunities with the universities.
Yeah, NVFS is Northern Virginia Family Services, and they do have a homeless shelter. They have about 9 other programs as well. So they do a lot in areas of poverty, foster care, early childhood development, things like that. So their reach is larger than other shelters that I'm used to. But it's been a very beneficial partnership. But for the logistics and how it came about, I do apologize, but I can't speak to that.
Sure. So I guess the second question here goes back to I think the discussion with Blair, and Blair, feel free to chime in. But what messaging could assist with testing uptake? I mean, is there any messaging that we could provide as support that you think that would assist with getting people interested in testing or less afraid? Is it? I mean, does the source make a difference?
I don't know that I have the answer to that. It just seems general discomfort. The last time I offered testing about a week ago, I was essentially like putting on like jazz hands, like, oh my gosh, I'm so excited. And, the resident just said to me like, oh no, I'm okay. Like, I'm just not interested. And, when I tried to probe for more information, it was just not something they wanted to discuss. So I'm not sure it's hard for me to determine how to fight that if I don't get a lot of feedback about the particulars of the fear or the discomfort.
I guess the other side of that, Mrs. Sabine speaking, Blair, for those who are doing testing, what have they said is their motivation for getting it?
Like I said, there's only been 1 or 2 people. They just seem to understand the importance of it in a congregate setting. So again, I haven't gotten much feedback, and I apologize. I feel quite stuck myself, since I understand how important it is. My staff understands how important it is. Giving a lot of information, and of course, it's obviously in the media everywhere. So I just don't understand how to help people cross that bridge.
This is Susan, and this is for anybody out there. Do any of the providers, do you have signage as far as information on testing? Do you need it in other languages? Is there anything on that issue that we can provide, or either provide to you where you can get that information? Do you have the languages that you need? So that would kind of be a general question for any of the providers, please.
I know that we have information, signage, and language capabilities when necessary.
Okay, or if you need signs in different languages, let us know, because particularly Spanish is already available on the website and things like this, that we can link you to the website if needed.
Thank you.
Thank you, Blair. And anybody else that comes into wanting to post something up, there's plenty already developed, so you don't have to go out and reinvent the wheel, shall we say. And I think, Dr. Brooke, that you have something you were thinking of.
Yeah, thanks, Susan. I was curious about I was curious about 2 things. Like, I guess the first is that to hear if other providers have had similar hesitancy among residents or staff in getting testing, and what approaches have they used to try to encourage these people to get tested? That was the first question. And then the second question is, if one of the things that we're able to do at the health department is if there are providers who essentially really don't have close relationships with their local health department, but would like to have closer relationships, we can certainly help facilitate that. So I guess one question and one comment.
I would say something about testing residents. I hope I didn't imply that they all did it every week, because that's not that's not the case. We offer it every week. We found that residents were more likely to participate in the testing if anybody had the sniffles in the shelter. Regardless of what was going on, it seemed to, I think Blair spoke to this a few minutes ago, it seemed to be that residents were more willing to get tested if there was fear around living in the congregate setting. They also certainly were more willing to do it when school started going back into session. Our schools have been in person now here for a very long time. And so when kids in the shelter were starting to go to different school systems within the region, folks seemed a little more interested in testing. But also we did our shelter staff testing and resident testing at the same time. And so if there were some folks who we were really hopeful would participate in the testing, our staff would just say, hey, we're going over to the office to do testing on Friday morning. Do you want to ride along, or do you want to walk over, or whatever? And so it was something that they did with staff who they had a relationship with. But certainly it's always been optional. We haven't required it to come in. We, you know, unless there's symptoms or something else going on, something else present that we're coordinating with our health department. There has been a good bit of vaccine hesitancy as well. And I think we've seen that just kind of across the country. And so we're navigating that, but of course have offered it to anybody who wants it. I am hopeful that more folks will take us up on it when it is the 1-dose vaccine. We should have that this week or next available. So anyway, I didn't want to imply that all of our folks were doing it every week, but that all of our staff were, and that it was certainly available to all of our residents every week.
Well, that is, thank you, Laura. That is, excuse me, that is great that that you offer testing once weekly, because that is, it seems pretty clear that that is a direction that CDC is kind of moving towards, is the idea of not just doing testing, you know, not just waiting until people get sick and then testing them, but really trying to take a more preventive approach of saying, okay, let's look at these people who are in higher risk jobs or settings, and let's really reach out to them and say, hey, we would encourage you to get tested, you know, not required, but we would, you know, encourage it. Are there any, oh, go ahead.
Well, I was just going to say, I really would encourage folks on the call who do not have that close relationship with their health department to take Dr. Rosheim up on his offer. That really has been for us the difference between, I believe, avoiding outbreaks and being able to be proactive. And the screening, I think, has allowed us to stay open, you know, this whole time. And that is pinpointed back to our relationship with our health department. And I want that for everybody across the state.
Yeah, that's a great point. And one of the questions that I was going to pose, and, you know, people can either respond on, you know, just, you know, by unmuting themselves or via the chat. Are there organizations that would like to have closer relationships with their local health department? Aaron?
I guess I'd be interested in hearing from Laura or Sarah or Blair, if y'all have any thoughts on that.
I think we have a great relationship with our health department. They are supportive. They were involved in the testing of staff when we had a potential outbreak. And they're usually my first contact when I have questions or concerns. So I super appreciate the relationship, and they have been helpful in trying to get people vaccinated here in shelter.
Yeah, I think the only gap that I'm recognizing that could be helpful is that our health department hasn't come on site to our shelters. And so that might be something that could be super helpful. So, you know, that's worth, I think, exploring for us on our end. We just haven't asked that question because we were not aware that other communities were having that kind of access. So that's great to know.
Sarah, I'd like to share, they did an audit of our shelters. They came and sort of took a look around and talked about our procedures and wanted to make sure we were behaving in a way that was preventative. And I did find that very helpful. I mean, that was probably almost a year ago, they came and did an audit. So I would maybe just start there and then see if that opens a conversation.
Yeah, that's great.
Yep, and Susan just left a comment in the chat that I'll go ahead and read. If there are providers who would like to know more about accessing DMAS transportation, you can let us know in the chat or shoot me an email after this, and we'll coordinate getting that information to you. So I do have one question for each of the three of you on the panel, and anybody here actually, but I specifically mentioned the three of you because you do have testing in your community, and there were respondents to the survey who did not have testing going on, at least at their agency. And so my question is this: if you were to pull one major lesson that you've learned in your attempts to get COVID-19 testing in your community or in your agency, to those, one lesson that you'd like to share with those who do not have testing, what would it be?
I think the message that I'm hearing from everyone is it's about those partnerships. And so, our testing with our FQHC didn't just happen. It was, through a partnership and through conversation and working out sort of that arrangement to make sure that our folks were prioritized. So I think, obviously it's a great opportunity for all of us to collaborate more. Reaching out and asking has always been super successful.
Thank you for that.
Aaron, do we want to move on to one of the other discussion questions?
We can. It looks like we've been kind of jumping around. We can.
Sorry, Aaron, just based on what people have been saying, I know transportation has consistently come up, and I wonder if there are any success stories or brainstormed ideas of options for transportation, because I know that's come up as a barrier in several of the survey questions.
Absolutely, and yeah, we would like to hear from you, including the panel, if you've had any success with transportation or challenges, if public transportation's been an option, or if public transportation is not available, have you been able to have success with rideshare programs, or rideshare services rather?
In the beginning, when we were trying to determine how to get people to testing sites, which were a little further away, we're going to kind of absorb the cost via our business account with Lyft.
Do they have concerns that they're transporting someone who is potentially infected, or is that ever a barrier to using Lyft?
I think it's sort of an ethical question, because anybody you pick up would have that concern. So we are not disclosing. But yeah, we discussed it internally, what that looked like. We do have several vehicles, but I was not wanting staff to do that. I just felt like it was really time consuming to have to drive someone, further away. So we felt like Lyft was a medium.
Sure, and my thought was almost more towards, even if you're not disclosing it, do Lyft drivers ever refuse to give rides if they understand that they're driving someone to a testing site?
Great question.
So you've not encountered anyone who just cancels okay, that's good to hear.
Aaron, I'll say that from our early conversations with our sort of community group, our local hospital system volunteered their community paramedic program, both for transportation and for monitoring once individuals were in a hotel for isolation. So I think that was really successful, because we kind of had that same of, how do we get folks who seem to be COVID positive or who are COVID positive testing and then to isolation, because obviously the majority don't have their own transportation. And so yeah, working with our hospital system to have their community paramedic program both transport and do the ongoing monitoring has been really successful.
Yeah, thank you, Sarah. And Laura Beth just dropped an important comment in the chat to me, which is part of the entire idea behind the Clia certification and having point of care testing is as an opportunity to overcome those transportation barriers.
This is Brooke Rossheim. I just put a couple of things into the chat. One thing that we're always interested in is, are there other groups who you feel that who might be interested in this presentation about testing, point of care testing, antigen testing, that we should reach out to in terms of getting the word out?
And this could even be, I mean, maybe especially non-funded partners. I mean, it could be faith-based organizations, rescue missions, Salvation Armies, other organizations that would benefit from having this information.
One of the things that's helpful is that at the state we have resources in terms of offering free testing materials, so we can really get places kind of up and running if they're interested.
All right, so we're getting close to time. I guess I'll go straight to that last question, and then we have a feedback poll on the next slide before we close this out. But at the at-home testing, as that becomes available, is that something that piques the interest of any of the homeless service providers on this call, or is that something that you could see being an opportunity for testing and homeless services? And if I'm not mistaken, these are tests, and Dr. Rossheim can correct me here, where you have the test, you administer it to yourself, and you really just need an app for some of these tests.
That's right, Aaron. These are tests that are meant to be, the specimen is self-collected. It's very easy to do, and the result is generated at home. Usually there is a smartphone involved, and again, very simple to do.
Well, thank you for providing that information. We see Blair noted in the chat, excited about the possibility of in-home testing for residents as they enter shelter. And I hope that's maybe something we can get more providers excited about. I guess before we move to the next slide and close this out, do we have any additional questions from the panel?
And Aaron, I'd love to just jump in here for a second. It sounds like things like the at-home testing will really assist with that transportation barrier. So, individuals don't have to leave to go to testing. But it sounds like there's a huge interest and need in educational materials or some type of messaging that we don't necessarily have now, but maybe individuals on this call might want to, in moving forward with our meetings in homeless services, maybe we can collaborate and figure out what messaging might work to increase testing uptake. Because the other side of this, it sounds, is like individuals like Blair have a lot of testing opportunities, have these incentives, but people aren't jumping on it. So how can we get people to agree to testing or be interested in it or understand the need for it? So that might be a next step for all of us.
Sarah, this is Brooke Rossheim. Is that something that you would be in? I mean, if we put together that kind of a work group, would you be interested, or would others be interested? I don't want to put you on the spot right here, but would others be interested in serving on that kind of a work group?
All right, can you repeat that?
Yeah, if we were to put together a work group about messaging for the homeless shelter providers, continuum of care providers, about how to message testing so that we can get more residents and staff tested, would people be interested in serving on that kind of a work group?
Yeah, I think that would be really fascinating.
And I'm sorry, who is talking?
Sorry, this is Sarah Quarantoto, but yeah, I think I imagine that you would have lots of interest with that.
Okay, all right. That's great to hear.
All right, well, thank you, everybody who stuck it out this long. We have one poll that Susan's there it is. It's another 2-question poll, so please just drop your honest feedback into the window that popped up about, what is the value of this meeting for you? And then understanding and testing COVID or variants will be with us for some time to come. Would you like additional meetings to offer suggestions and collaboration? So please, again, answer both those questions and hit submit, and we'll be able to generate that live data.
Looks like we've still got a few answering here, Aaron, so we'll give it another minute here.
Okay. And the final slide is up that has the contact information of the 3 speakers we had from the Virginia Department of Health, Dr. Brooke Rossheim, Deborah Hopkins, and Dr. Armand Devani, as well as my contact information. And again, the session was recorded. Slides will be available at a later date. And here we have the results. Is that was this meeting of value to you? And the answers were somewhat evenly split between 3, 4, and 5 being the higher. So that's positive feedback. And thank you for being honest. And then understanding testing and COVID or variants will be with us for some time. So would you like additional meetings? And we had 64% responded yes, 7% no, and 36 said yes, but on other subjects. So thank you for responding. And we're at noon here, so I'm just gonna close this out by giving a big thank you again to Susan for hosting this with your Zoom. A thank you to Brooke, Deborah, and Armand for providing your expertise with the slides, and for Sarah and Blair and Laura Beth for being willing to speak up about your communities and provide us with some of the lessons you've learned and challenges and successes you've had in your community. And we hope that this continues to be something that we make valuable with the slides and with the PowerPoint being available on YouTube. And we look forward to continuing this work. So thank you all very much.